Welcome back, everyone, to a podcast to answer your questions on addiction, recovery, and mental health by Wiseman Rapid Detox. I'm your co-host, Dwight Hurst. I'm joined today, as always, by Claire Wiseman and David Livingston. Today, we have what triggered our discussion today is, David, you sent out an article. No, you didn't. Marina sent out an article. Claire somebody sent out an article. With these group texts,
it's the new study that just came out from the CDC.
Yes, exactly. Group texts, I need to figure out who sent what, but it doesn't matter. It is an article by Mike Stobe is the one who summarized this, but you're right. It's data from the CDC, and it's titled U.S. Overdose Deaths Topped 100,000 in 1 year, officials say. An estimated 100,000 Americans died of drug overdose in 1 year. Never before seen milestone that health officials say is tied to the COVID-19 pandemic and a more dangerous drug supply. I'm not going to read the whole thing. I just got into that paragraph.
I read the article too.
Yeah. So let's dig into this. I know we've touched on this before. The obvious epidemic nature of this. But this is, for me, more than, I don't know if it's more than anticipated. I think by talking to you, Claire, I've learned to anticipate it going up. But what are your thoughts, your guys' thoughts about these numbers here?
Unfortunately, I saw this coming a long time ago. More unfortunately, I believe these numbers are low to what reality really is. The data is taken from, the data coming out of morgues. So, that's how they know how many people died. But I believe that there is a lot of people that died due to especially fentanyl. In a number of different ways. There is also a lot of suicides that are overdoses. People really did not mean to die. So, as horrible as this is, I think reality is much worse.
I think it is difficult because those things are always underreported. I mean, particularly because of the criminal nature of some use. If it's heroin use, people don't like to talk about it. And if they're good at hiding it, and they may or may not be, there are certain things that sometimes on reports, people don't like to include the facts about that because of shame or embarrassment sometimes. And so I guess, I don't know the particulars of this study of where it all came from, but I think you're absolutely right. Whenever we have an indicator of something like this, it's almost always low, right?
Yeah, they say it is provisional, so this is not, the final data. And sadly enough, every time we see a final data is worse than, the original data provided to us because, they investigate more and more and they find more and more. Now, this was until April. Now, if you figure out the amount of fentanyl that has walked in to this country since April, and again, unfortunately, data does not show up for the first 6 months to a year.
Yeah,
I think we're going to see a tremendous higher number in the next year or so for the current time we're living in.
There's no doubt. I'm sure the numbers are much higher, as you're saying, Claire. And I mean, just to put it in some perspective, with when COVID was here, we shut down the whole country. Half the world shut down. I mean, nobody went to work. Everyone wore masks. And there was a period where, there were ultimately a lot more COVID deaths. But if you really look at, if you want to scale it to the impact of something like COVID compared to well over 100,000 deaths in a year. And I can tell you from just talking to some people very, very recently who were taking, that people don't even know what they're getting in medicines anymore, and where they think they're doing this, and then they find out that they're, um, um, and whether they're smoking it or they're inhaling it, they do a tiny bit and they're on the verge of dying and didn't even imagine that they were going to be in that level of jeopardy. So fentanyl is terrifying, and it's already wreaking unbelievable havoc. If there is ever a reason to get off of and stay away from, buying things and opioids off the street and so forth, it's the danger is just profound.
What's some of the drive that increases the supply of fentanyl? Is it cheaper for dealers to get a hold of, easier to get a hold of? I mean, I know there's
all the above. So
yeah,
I'm sorry, all the above. So this is being manufactured mostly, right, in China, and inserted in different drugs in Mexico and brought in through Mexico. The amount of fentanyl you need, one little tiny bit of fentanyl, it's 100 times stronger than most opioids out there. Now, there's also analogs of fentanyl. That's a completely different ballpark. I mean, you're talking about thousands of times stronger. So they can bring 1 pound of fentanyl into the country in a backpack. And, they can overdose a whole city of it.
Wow. And one of the things that I believe opioid and heroin users get pretty used to is measuring out. They get to know what amount they can tolerate because of tolerance and buildup. And historically, that's one of the most dangerous things about those drugs is that people are often wrong, or they underestimate if they've been clean for a while and they relapse, the amount now that they used to take can kill them. I know that, that's been, or occasionally a crumb or a piece of pure heroin will get in, and that's always been a problem. But now they're saying you can almost count on the fact that if you're buying opiates, if you're buying heroin, you're probably buying fentanyl, and the amounts are completely random from the perspective of the user. To say whatever someone might say is I'm doing air quotes here, safety. It's never safe exactly, but someone who has been practicing use for a long time might have the illusion of safety is definitely amplified if they don't know they're using fentanyl.
When the user buy it, they have no idea there's fentanyl. These are people that are not tolerant to opioids. Overdosing is a certainty. They did not think they were even buying opioids. Mm-hmm. Their body is not used to that, and suddenly they take, a drug is much stronger than any opioid they could have ever tried. So they overdose. For me, it's murder because, if you're buying something and you're being sold something else, a poison, for me, it's pretty much murder at this point.
It's an interesting thing, and it would be interesting to know. It's hard to capture data as far as marketplace data that just doesn't really exist, right? To say how far does that go from perhaps the person who maybe I know that I might purchase from? Are they aware? Is it the person that supplies to them? Are they aware? And that could amplify and multiply. The problem grows exponentially the less that people know. in a
Oh,
way, right?
if you're asking how reliable is a drug dealer and how honest is a drug
Right,
dealer, I mean,
exactly.
it's comic almost, right?
Right, exactly. I mean, even if the person is someone who doesn't want their clientele to die because they want to sell, but at the same time, there's a lot of that where it's just there's no personal attachment, and I think, and a lot of times certain drugs lend themselves more to that, where an opiate user is going to be dependent upon finding drugs to avoid withdrawal. So there's also a drive inside that person, right, to say, I may not even be chasing a high anymore. I'm just trying to find, and I need to today, or else I'm going to be in trouble tomorrow physically. And so, more likely to make I want to say an unwise decision. I mean, even compared to the decision to buy heroin. Yeah, there's a desperation.
It's a free for all with, I mean, like you're saying, Claire, other drug, benzodiazepines, if they're being bought off the street, and often they're made to look like other, prescription drugs or other things. You have no idea what you're getting, and it can be laced with fentanyl. How much, nobody knows. People selling it don't know. I mean, it's. I don't think it's ever really been as bad as it is right now in terms of. And there's,
It has not.
Yeah,
I've been, at least in the last 25 years that I've been working in this field.
Yeah.
It has not, David.
Right. So there's always been dangers. The danger now is at a level it's profound, and so I'm glad we're talking about it, because and it's shocking to me that there isn't more being done about it. Just from I just that more isn't being done, and it's not even bigger in the media, in the public eye, and so forth. But
no, it's extremely preventable. Most of what's going on is preventable, but there is a total silence regarding, this tragedy that is going on in our society, and I believe the silence is fueled by political reasons.
Be that as it may, it's because, like you said, the amount of fentanyl that you can carry in a backpack, there will be no way to ever prevent it. So individually, families, healthcare workers, individuals are going to have to make decisions, because if you're playing around with this, it isn't experimental anymore. It's you're headed for trouble sooner or later, especially if the deeper you get into it, where it's harder to make it, deeper or not deeper. You don't even know what you're getting. So if there was ever a time,
I agree with you, David, and I disagree with you at the same time. I think as a society, there's a lot we can do. I think we have nowadays social media, that all kids are connected to around the clock. That could be a tremendous force to prevent what's going on, to educate people what's going on, to warn people on what's going on. And I think is used to distribute the drug more than to warn people of its dangers. So I think a 14, a 15, a 13, a 16-year-old kid that is going through, serious emotional issues, not always have that choice you're talking about. They also don't have the, ability to understand consequences. I agree and disagree with you. I think as a society, there's a lot more we should be doing to save lives. Maybe we won't save all of them, but we can definitely save quite a bit.
I agree with all of that. I'm just saying the chances of being able to prevent, the transportation of drugs and so forth is it's never worked. And so we better take on other avenues, like you're saying, like media, social media, and all kinds of ways. I mean, I remember when I was in school, and it's a long, long, long time ago, that someone would come in with needles and talk about heroin. And it was so terrifying just to look at it, that it was like, oh my gosh, like, why would anybody want to do that? But I don't think in schools and so forth, people are getting educated at of the real dangers that exist now. Yeah, I mean, where kids are getting scared, right? Because one of the biggest, I've talked about this before, you need to be scared before you start to mess around with this, because once you're messing around with it, the fear goes down. That's one of the things that happens when you tend to be on any drug. You tend to feel less, and so you're going to feel less fear. You need to feel scared up front and early on. And I think there should be, I mean, one of the things we're all talking about in this discussion is the dangers. So, with the purpose of, eliciting fear in people who are thinking about this or are aware of it. So, it's a dire situation right now with the fentanyl that's coming in.
It is. It is. I think society has changed as well. And again, I'll bring social media back, because when we were growing up, all we had was, somebody to come into our school and talk to us about something. We didn't have our phones. We didn't have, internet. We didn't have all the things we have today that can, not just provide us with information instantly, but almost shape our minds and our thoughts. And I think this is unused and misused. That's what I'm trying to say to you. I think, entertainers are a huge part of this. They could be, creating campaigns and, flooding the internet with the dangers of it. So that's where I'm coming from. And I think I keep going back to the same point, because I have never heard, and I'm sure, David, you talk to patients more in depth than I do. I have never heard the almost indifference that especially the young patients are talking about their friends that pass due to overdose, because it has become part of their reality. So they talk about, I lost 2 friends, I lost 3 friends, I lost my brother. So in such a mundane way that I think is what's going on is not just affecting those that die, is affecting generations to come in so many different levels. It's like part of their heart is not even feeling anymore.
It's almost like a type of PTSD, where you've been exposed to so much that it no longer affects you in the same way. And so once you start talking about 100,000 deaths so we're talking about mostly young people. I don't know what the exact ages would be, but from the people I'm talking to, like you're saying, I mean, I've talked to people, I've talked to young people in their early 20s who've said that all of their friends are dead from this. And they've left 8, 10, 12 people. Sometimes while they're here getting detoxed and so forth, there'll be people who die. It's so rampant that, and it's heartbreaking. And you're right, it's becoming it's like we're announcing the number, right? But and that's maybe why I compare it to, look at the response to 100,000 people dying from COVID. I mean, the whole country just turned upside down. The response, in terms of a society was profound. And if you look at that compared to 100,000 people dying from fentanyl overdose primarily, the response is next to nothing.
You had said, Claire, that there's a concern. You have that concern that if it were talked about or addressed the way to the level it should, it would open up some, it sounds like, hard questions people might not want to think about or talk about when it comes to security of what's coming into the country. I wonder if there's also a hesitancy to engage because people still like to treat drug use as, well, it's a choice. Well, if you got sick, then you got sick. And well, because even within the COVID thing, there's a lot of blaming of people who, and some more valid than others or whatever, but to say if you're not taking precautions, then you're spreading a disease. And I mean, we do have it just seems like there's almost a feeling of like, well, if you did a thing on purpose, then you get what you get. And as you put it, there's a lot of people in vulnerable positions, self-medicating, or young people who are manipulated or just, don't, or have learned to accept it, like we're saying. I guess what I'm trying to say is I wonder if that's some of the hesitation is still that sense of blame or shame that's around drug abuse.
Right. I think there is some of that, but again, I think we have come a long way with that. You know what I'm saying? People expose a lot more shameful behaviors than that. And I think after, the opioid crisis, that showed that, 82-year-old Mary that had 4 hip surgeries became dependent on opioids and pain pills. And we have lived through that, prescription pain crisis the last decade and a half. I think it changed how people saw addiction. Is like everybody I know knows somebody that has suffered from one addiction or another.
Do you feel like that's broadened the conversation?
And no. Mm-hmm. So that's what I'm saying to you. I think it could be, but it's again, it's a number of factors, but I think that's a very, very small factor. When David brings COVID up, that everybody, took such a stand on it, and they still do. They do because, again, for political reasons or not, it is something that is everywhere, in every part of our day. And our phones is giving us alerts, the media is giving alerts, the TV is scaring us, So there is a lot of influence of those that have an agenda and wants to steer us one way or the other. The fentanyl crisis, sadly enough, there is no agenda to solve the issue. I think if we are going to think about the issues, and I'm not just talking about the influx of fentanyl through our borders. You had a whole study from the CDC where lack of accessible mental health was not discussed. So when we talk about people that were isolated during COVID, and that's one of the reasons why, the overdose was so high, I'm sure that's a major factor. But you're talking about people that have mental health conditions, that have no means to get help for that, or have never been diagnosed. And even if they do, they don't have the means to get appropriate treatment. Lack of mental health care is one of our number one flaws in this country, and one of the reasons why so many tragedies happen. I mean, from drug addiction to murders to homelessness to so many things that affects our society.
And I think that, one health crisis feeds the other, right? Where you're seeing some of the economic realities where I'm seeing that where people maybe lose their jobs, which then means they lose their health insurance, right? And so they don't get treatment or even medication, which can be very expensive. And then there's also the isolation feature that happens where people are staying away from each other, and that isolation doesn't lead to sobriety, generally speaking.
But even the ones that do have health insurance, health insurance pays for such a minimum portion
It's
of
true, yeah.
mental health care.
Mhm.
So it's they get to see somebody one, two, or three times, and that's it. I mean, a
It, it,
psychiatrist is extremely expensive.
it's rare that people actually get treatment.
It's
It's
rare.
it's rare. I mean, far. I mean, so rare I can't even tell you. Um, it's a serious commitment by both somebody who's skilled in treating it and somebody who truly is committed to getting better. And you don't see that combination happening very often. Um, and and we don't talk about it, and with the seriousness and the gravity that is necessary to actually get people better. There are and I think really we just glance off it. If we glance off it in terms of treatment, and you get the research that says this is helping, that's not helping, but it's like in all successful treatments and all and in getting good and or things getting better in anything, there has to be a profound commitment to working at something, and this is a hard thing to get through, and a hard thing to get over, and a hard thing to get better at, and so we're the programs and the treatments that are in place don't usually bear down at the level they need to. And just as you're saying, Claire, it's also not happening in terms of, the way the media is handling it, the way that social media is handling it. I mean, if you compare that to the depth in which, as a culture, we committed to the treatment of COVID, in terms of the finances, in terms of the medical community, in terms of the business community, and socially. I mean, you forget your mask and you're going to walk in a store, you get 10 people staring at you, right? And
Yep.
and understandably, like, because everybody wants to have but that's the weight. Imagine if you had a weight like that bear down on something that's just killed 100,000 people, and mostly young people who primarily, almost entirely, would prefer not to be involved in that type of process, but are, for tons of factors, are kind of caught up in something that they don't know how to really get out of.
Well, it kind of ties back to some of the nature of these types of drugs. Is not only are they addictive and dangerous, but the dependence feature, to where people are just kind of trying to chase away the withdrawals many times. And I think people don't factor that in if they don't understand it, right? To know that, once again, that's where the desperation comes from, even more than pleasure seeking, which I think is how we think of it a lot of times.
I think it's there is such a misunderstanding from the public on the pleasure seeking term. I think most of the time is not pleasure seeking, is truly to self medicate unwanted feelings. Is such a despair of that constant feeling of of pain within, that once you feel a relief of that for the first time, it's hard not to go back to.
Yeah.
And then again, dependence takes hold, addiction, chemical imbalance, all the above. And now, you start having, you go from Vicodin to OxyContin, from OxyContin to Fentanyl, and things just snowball to an endless, tragedy. But I think more than pleasure, people seek substances because they just can't handle how they feel, and that goes back to mental health. I think
Yeah.
if they are able to receive the mental health assistance they need, we would see a lot less of the pain we see all around.
Mm-hmm. Yeah, I mean, as we're talking, it seems to me one of the things that could be helpful would be to make sure with your loved ones, especially if you know that they have symptoms or if they seem to be highly anxious or go through depressive episodes, or, whether we know directly or not, trying to encourage people to get mental health treatment. And perhaps, for those that have the means or the ability to say, not only encourage their close family members or their friends to get help, but I mean, one of the things you could do is say, let me help you get some help. Is there a way you can, if you have the means to chip in, or if you have insurance for your family and can redistribute expenses, or I guess making it that priority. And I'm not meaning to say that everybody can just do that. However, there are sometimes, if we reallocate our resources, we can find that we can at least engage with something, or looking into community programs, or just that might be something that would be a good strategy for people to help their loved ones.
Yeah, and I think again, we can, not just as healthcare professionals, but as part of a society, discuss about the lack of and how much is needed. So, if you are denied, or a family member, the mental health care you need, talk about it. Talk about it on social media. Let people know. Um, Maybe we can change the system a bit. We can't just stay in silence and expect things to change. I think it's important to talk about the going back to the reason why we're here today, the dangers of any illicit drugs. It doesn't matter if it's methamphetamines, if it's benzodiazepines, if it's opiates. If it's out there, it's likely laced with fentanyl.
Mm-hmm.
I think it's extremely important to talk about that. Um, and I think it's also important to talk about what's missing, and how we can change that. I think in schools, especially high schools, it's so important to have somebody that can hopefully diagnose something from the beginning, so the student can get the help they need before they turn into drugs to self-medicate. So I think prevention and education is the foundation of any healthy society.
You had started, or were starting up a hashtag on Twitter, right?
Yeah, still there. Yep.
What is that again? Will you tell
Stop
everybody?
the silence. Yep. But again, you know what I'm saying? I think we have become, we live so much our own lives as individuals that we forget that we are just a little part of something so much bigger than we are.
Right.
And we have the ability to have a voice.
I think what you're saying is exactly maybe the most important part of it, because it's one thing to just publish a number and send it out. 100,000 people have died in a year from overdose, and that unlike COVID felt like it was going to affect everybody, and that there was a mandate as a society and a culture, and it was. I use that because it was so. You really you got to see the power of, even in a divided culture right now over many, many things, you got to see the power of people wanting to be protective of themselves and other people, and what, a society can do in terms of coming together and trying to sort of end something that is potentially dangerous to everybody and not good for anyone. And this is the same thing. This isn't good for anyone. It's and yet, as you say, Claire, the silence is profound. And I think partly because most people see it as something that's affecting other people and not affecting them, and significantly that can be true. And so that's that. I don't know how you overcome that. that would be something to really think about. And maybe it's what you're saying about social media and people who are, but there has to be so many people who get involved, and it has to continue. If you remember with COVID, I mean, it was nonstop, and my phone would be dinging nonstop with that. There was a report coming from everywhere for a year. It was the weight of it was so profound that it became part of people's consciousness in a way that I hadn't seen anything else sort of in my lifetime really sort of be dealt with that type of gravity. And why we could do that with this too. We could absolutely do this with too. It would just take a willingness to do it. And you'd have to get the media and social media, the media in general, and political entities, and you'd also have to get the government to all just bear down on it at a level together. But it's possible.
It's possible, and I think each one of us starting something. Number one, makes people feel good that they are being productive. They're helping something, and I think is just a combination of people together trying to reach the same goal. Even if they decide to go through different paths of reaching the goal is the same. Now, can you just imagine, as David was saying, because my phone the last 2 years pin for every time ICUs were getting full, or every day showed us how many more cases have been tested, how many more cases got positive. Can you imagine if our phones would ping every day of how many overdoses that day? And if we we don't need to put a name to it, but we can put an age, we can put, a 15-year-old boy, 18-year-old girl, we can, something.
If every news organization covered it every single day for 1 year, and everybody's phone were dinging the same way, if you just did it through that one avenue, you could change the consciousness of this epidemic. You're 100% right.
Of course we can, but again, David, there are reasons why it's not done. The reasons that we saw that with COVID, so people ran and got their shots and protected themselves and used their masks and whatever else. There is a complete disregard for people's mental health.
It's also their lives too. It's interesting. I mean, why do you think there isn't a desire? I mean, because really what you saw was the media. I mean, when you see the media get really ramped up on a subject, they will go with it, and it will be front and center, and everything that happens will be oriented towards that. This has not happened with this, and when the more I think about it now that we're having this conversation, why 100,000 people?
Because of political reasons. And it's not 100,000 people. It's much more than 100,000 people.
No question. No question. It could be 1.5 times that. I don't know, but it's 10 times. It's much more than 100,000, right? Which is just shocking as a number.
Listen, on my way if you ever take the 405 to Century City, you're gonna see a huge electric billboard that shows how many people this year has died of cigarette smoking. And the numbers change continuously.
Right.
Put one of those billboards in every major city showing how many people have died of fentanyl.
That would be something, wouldn't it? I mean, talk about raising
it's simple.
awareness. Yeah.
We have the ability to do that very easily.
Mm-hmm.
But if we can do with cigarettes, I guarantee you we can do with overdoses.
Mm-hmm. Right, but how about if you got the LA Times, the New York Times, the Washington Post, Fox News, and every other major outlet to spend 1 minute a day for the next year and send things out, because they send a million things out all the time. It's part of what they do. It wouldn't cost them a nickel, and they just sent that all out. And you just got the major news organizations to send out
because it is not part of their agenda. We go back to the same point. They're going to say, why is fentanyl coming in? They know the city in Mexico where most of the fentanyl is being produced.
I do not think. I think, in the end, it's going to have to be dealt with. I think your first idea was the best. I don't think you'll ever. I don't think, and I could be wrong. I certainly have no expertise in this, but the idea of trying to stop drug people from making drugs or transporting to the U.S. has never, ever, ever worked. So and not that we shouldn't do everything we can to curtail that.
And I hear you, David, on that, but you're talking about a complete different story right now.
Yeah,
we have reached a complete different stage of bringing drugs into this country. And again, you're not talking about drugs that people get addicted and, years later they go to rehab. You're talking about people being murdered. You're talking about people that use for the first time and they die. It's a different story altogether. When I asked Dwight today to talk about this, is because people need to be warned.
And
that whatever they're buying out there, I don't care if it looks exactly like a Percocet, it's fentanyl.
Well, do you know what the major demographic of the people who are dying is? Demographics?
Yeah, it is in the study. I mean, it's mostly, I would say, and I don't want to be exact because I don't have the study in front of me here. You're talking about late teens to early 20s. Oh, no, I'm sorry, to late 20s. But it starts. Okay. The study starts showing kids as early as 13 years of age.
And what is the race of the people who are dying mostly?
You asked the race?
Yeah. Are they? Is it mostly
I don't
white?
Think that was
white?
Part of. I don't think that was part of the study.
I think it's predominantly young white people who are dying.
It's people. Period.
That's right, but that's right.
It's people.
But I couldn't agree with you more, and it doesn't matter who they are.
Exactly.
Right, but what I'm saying is, you're talking about politically, because it is just people, and if there is, and what happened with COVID is it didn't matter. It was a moment where this country pulled together, and all the people, no matter what, there was an idea that we have to look after and take care of each other, and there was and not everybody went along with it, but profoundly that was the feeling, and that's what it should be here too. It should not be political. It should not be where any group is left out, or it should be. Young people are dying in this country. It's unbelievable, and politically, everybody should be on board, and so should all the news organizations, and and it's unbelievable that you don't hear much about it at all. I think your caption is "Stop the Silence" is right.
And that's going to do it for today. Thank you so much again for joining us. Looking forward to next week when we're going to be talking about plans for the new year that's coming up, as well as talking about the anniversary of the Wiseman Center and some things that tie in with that, and learning a little bit more about the treatment. This podcast is a production of the Wiseman Method Rapid Detox. Claire Wiseman and David Livingston join us to share their expertise on addiction and recovery. Our music for this and all episodes is the song Medical by Clean Mind Sounds. This podcast is produced by Popped Collar Creations. You can go to poppedcollar.net to learn a little bit more. Please go to opiates.com to learn more about the Wiseman's method, as well as learning how to contact us to share your questions. You can also email your questions to us at info@opiates.com or hit us up on Twitter @opiates. Thanks again for joining. We will be back to answer your questions again soon. Remember to keep asking questions, because if you ask questions, you can find answers. And if you can find answers, you will find hope. We'll talk to you again soon. Bye-bye for now.